Hello everyone, welcome back to my channel. Today we'll be looking into stab wound. Earlier we have seen the classification of injuries, and under that, under sharp force injury, mechanical injury, and under that we have sharp force injury and blunt force injury. So under sharp force injury, we'll have stab wound and incision wound. Under blunt force injury, we'll have abrasion, contusion, laceration, and fracture. So today we are starting with sharp force injury, and in that the first topic is stab wound injury. Okay, let us start stab wound injury. So before starting the lecture, let me tell you that we will be covering this whole short note, which is very important, the whole stab wound injury short note under 5 topics. The first is of course the definition, second is classification, third is characteristics of the wound, fourth is we'll be looking into the difference between suicidal and homicidal stab wound. And fifth, last but not the least, is medico-legal importance. So these 5 topics, or I mean the 5 headings you have to remember. And once you remember these 5 headings, the short note is very simple. So let us start with the definition. So here is the definition. What is the definition? So stab wound is nothing but the penetration with long and narrow instrument having pointed end. The depth is greater than length and width. Depth means uh, how much the weapon has gone inside the body. That is the depth. Length and width is how long the injury is visible on the skin, and width is how wide the injury is visible on the skin. Depth you of course cannot visible through like 2D image. For that you need 3D image. Okay, so depth is greater than length and width for stab injury. The weapons generally used are knife, scissors, ice pick, and screwdrivers. These are the most important ones. There are more than 100 weapons, but we are not concerned with that. Okay, so definition is penetration with long and narrow instrument having pointed end. Depth is greater than length and width, and you can write the examples of such weapons: knife, scissors, etc. Okay, now let us move to the classification. So stab wound is basically divided into 2 types of injury. One is penetrating injury, and the other one is perforating injury. What is penetrating and what is perforating? I've explained this through an image. Here is the image. I've taken this from a book of Gautam Bishwas of forensic medicine. So penetration or penetrating injury is nothing but inserting a weapon into the body, but the weapon doesn't come out. Like there is input, but there is no output. And perforating means there are 2 wounds visible. One is for entry, and the other one opposite to that, exit. Okay, so this is the perforating wound. Okay, one is penetrating, another one is perforating. Simple. Classification is over. Now let us move to the third heading, and that is the characteristic of stab wound injury. And here under characteristic we'll be covering 4 topics, like 4 points. One is margin, second one is depth, we'll be discussing about the depth. Third is shape, and shape under shape you have to remember some 5-6 weapons, and you have to remember the shape of, like, how it will be visible on the skin or on the body, the shape of that weapon. Okay, we'll look into it. And the fourth one is hilt mark injury. We'll see what hilt mark mean. Okay, so starting with the first point, that is margin. So margin for stab wound is of course clear, and there is no abrasion. What is abrasion? Abrasion in Hindi we call chiljana, and in Gujarati we called cholai jau. It is the superficial removal of the skin through friction. So of course in stab wound we have penetration, we don't have any abrasion, any kind of abrasion. There is just one exception in which we can see abrasion, and that is hilt mark abrasion. What is hilt mark? Let me show you the image of hilt mark. Okay, so here you can see this is hilt mark, end of any weapon. Of course, this is not present in every knife, but they are present in some of the knives. Okay, so that is the hilt mark. And because of this hilt mark, there are chances that there can be abrasion. So no abrasion. Exception is exception is hilt mark injury. This is margin. We have done with the margins. Now let us talk about depth. So depth, you already know that depth is greater than length and width. So I'm not writing it over here, but you can write in your university exam. Depth is greater than length and width. We've already mentioned above. Then depth of the wound will depend on some of the factors, and those factors are: one is clothing. If a person is having more clothing, thick clothing, then there are less chance, or there are chances that the depth of the wound, the depth of knife penetration will be less. Of course, common sense. Then another factor is location. Location on the body. There are some sensitive areas on the body, and at the same time, there are some resistant areas. Okay. The third point is force of application. Force of application, the more the force, greater is the depth. Then we have type of weapon used. Okay, type of weapon used. So depth depends on clothing, location, force of application, type of weapon use. The third point is about the shapes. So like I've told you earlier that there are more than like I don't know how many number of weapons exist in this world, but I know some of these 4 5 weapon, and this much weapon are given in Gautam Vishwas. So this has to be remembered. The shape of at least 5 has to be remembered. One is single-edged knife. What is single-edged knife? So one side will be sharp and the opposite side will be blunt. That is single-edged knife. Now apply some common sense. What will be the shape of the injury, the shape of wound that will be visible on the skin when it is penetrated? It will be wedge-shaped. Now what is wedge-shaped? Let us see. Wedge-shaped. Wedge shape is like this. This is wedge shape. Double-edged knife means both the ends are like both the sides of knife are sharp. So that will have spindle shaped. Spindle shaped is like this. This type of injury will be seen on the skin. Screwdriver. The most common type of screwdriver are that plus sign and minus sign. So you can remember this as like this or like this. Okay, circle will not be considered, plus or minus. So these are the shape when screwdriver is penetrated. Ice pick, the weapon which is used to break ice, the big cubes of ice, it will have circle, like small point. Okay, and fork, fork is 4 dots, 4 vertical dots. Okay, so we have seen 5 weapons, 5 different shapes: single edge knife, wedge shaped; double edge knife, spindle shaped; screwdriver, plus or minus; ice picker or ice pick is circle or dot; and in fork we have 4 dots. 4 vertical or horizontal, it can be like it depends. how fork is penetrated. Okay. Then we have hilt mark injury. The fourth point is hilt mark injury. What is hilt mark injury? So here I've written sometimes depth of wound is greater than length of knife. Let us try to understand this. For example, if you take a 10 centimeter knife and you insert the whole 10 centimeter knife into the body, then of course the depth of the wound has to be 10 centimeter, physics. But this is not the case. If you insert 10 centimeter whole knife into the body, then the wound will be 11 centimeter or 12 centimeter or 13 centimeter. So this is what I've written. Sometimes depth of wound is greater than the length of the knife, and that is known as hilt mark injury. This is sometimes asked as a 2 marker. So these 4 points, very simple. One is hilt mark injury, another one is the shape, in which we have discussed the 5 instruments or 5 weapons. Then we have depth of injury and margin of injury. Very simple. Then comes the difference: suicidal stab wound and homicidal or murder stab wound. So when it is suicidal, the wound is generally on the accessible location of the body. So this is not present at the hard reach out position like bums or leg. This is most commonly 99% it is abdomen, and that is the most accessible location for suicide. Okay. And in homicide, it can be anywhere on the body. The attacker may attack from anywhere. So it is anywhere on the body. Then we have number of wound. In suicide, it is generally seen that the wounds are there is single wound, and in homicide we have multiple wound because attacker doesn't want to take chance that the person should remain alive. So he'll make multiple wounds, irregular wounds. The depth may be variable, but it is confirmed that wound will be multiple. That is homicidal. Okay. The third point is clothes are spared. Generally, it is seen in suicide that a person will spare his or her clothes, like the weapon will not penetrate through the cloth. Either he or she will raise the t-shirt or shirt and then they'll penetrate into the body. This is generally seen in suicide, but in homicide, it is not the case. It will pierce through the clothes. And last but not the least point is weapon is generally present next to the body in homicide, in suicide, but in homicide, attacker may take weapon with him. Okay. But if attacker is smart enough, then he'll leave the weapon, vanishing the fingerprints. So he'll leave the weapon beside the body. These are the 4 points. There are many points given in the book, but as we are preparing a 6 marker short note, you don't have to remember each and everything. 5 headings are more than enough, and in that, the 4th heading, which is the difference, suicidal and homicidal stab wound, in that 4 points are more than sufficient. So these are the 4 and which are very easy 4 points. Okay. Now, one thing that you can write, you can remember is the cause of death. How a person will die if a stab wound has taken place. So it is hypovolemic shock, of course. After stab wound, there will be loss of blood. So it will ultimately lead to hypovolemic shock. I've written this one over the other. I'm sorry, it should be has to be in the single line, hypovolemic shock. The second is aspiration. Third is infection. Fourth is embolism. Fifth is cardiac tamponade. These are the cause of death you can remember, or you can just skip. The last heading is medico-legal importance. Here I have written 5 points. You can remember there are many points given in Gautam Bishwas, which the book which I followed, but I've written the important ones, the 5. These are more than sufficient. The first point is shape of wound indicates type of weapon used. Okay, like earlier we have discussed some 5 shapes of 5 different weapons. So shape indicates the type of weapon used. Then second is depth indicates force of penetration. Okay. Third is age of injury can be determined. If a person is alive, then there we can see healing process, and in healing process there will be change in color, like from oozing of the blood to bright red to brown to black and so on. So we can estimate the age of injury. Fourth is accident is rare. Why I'm calling this accident is rare? Because stab wound is in majority of the cases seen as either suicide or homicide. Accident very rarely occur, and that too in cases of animal attack, animal attack. For example, if cow attacks on you and और उसके सिंग घुस जाए आपके पिछवाड़े में, तो there are chances like you have stab wound. Okay. And second thing is fall on sharp objects. Fall on sharp objects like nails. If you fall from some height, or if you're walking barefoot and you have nail on the road, there are chances of penetration. Okay. The fifth is harakiri. What is harakiri? This is again asked as a short question or two marker. Harakiri is suicide by Japanese samurai warriors. It is a suicide by Japanese samurai warriors. I've shown the image, but let me explain how the suicide is done. So, first of all, L-shaped cut from left to right side of the abdomen is done. So, what they'll do, they'll penetrate either knife or sword to the left side of their abdomen, and then from left side they'll cut through and bring the knife to the right side. So what they'll do, they'll penetrate to the left side, and from left side they'll take to the right side, and then once the knife or sword has reached right, they'll take upward turn. Okay, like this L-shaped stab wound, and they'll ultimately die. This is harakiri. So 5 points, medico-legal importance. Here we come to an end. First, we have seen the definition, then classification, that is penetrating and perforating. Then we have seen characteristics. Then we have seen the difference between suicidal and homicidal wound. And at the last, we have seen medico-legal importance. Okay. Hope you like my video. Thank you.